You know, I think I was always fascinated by the concept of what doctors did and, you know, the power to heal. Really, the concept of gene therapy really lends itself to monogenetic diseases where there is a missing gene or an abnormal gene. And in gene therapy, what we do is we clone the exact known gene, and we utilize a Trojan horse, so to speak. In our case, we utilize an adeno-associated virus. And this is really the molecular truck that delivers the gene, but all of the components that allows the cell to produce the protein of interest. So we sought after a project, and this was led by Dr. Kevin Faust, to really search for one of these viruses that may have had a unique capacity to cross the blood-brain barrier and target cells following the administration into the bloodstream. And lo and behold, in 2007, 2008, Kevin came into the laboratory showing really unprecedented data.
I remember being at the microscope and looking into the microscope. And so as a scientist, you're trained to be sort of skeptical. And what I saw was so outlandish, or so far beyond what was capable at the time. Surely this was some sort of error.
Over 90% of the motor neurons were targeted in these very young treated animals following a one-time administration into the bloodstream. And the first disease that we thought about moving towards was spinal muscular atrophy. Spinal muscular atrophy is a motor neuron disease that affects infants. They will never develop any motor milestone that a normal child would develop. And most of these children do not make it to their second birthdays. Not too many years ago, a family with a baby diagnosed with SMA type 1, the clinicians would look at the parents in the eyes and say, there's nothing that we can do other than to make your baby comfortable, take your baby home, love them, your baby is going to die. In 2018, simply put, that seems unacceptable. This was a game changer within the field because these children always go down. And we started to see early on that patients weren't going down, and actually there were subtle initial improvements and then a little bigger improvements. And then we started seeing patients move their arms and move their legs. And I think we were holding our breaths. I can tell you I was holding my breath of, is this going to last? Seeing babies walk and talk, eat, laugh, run around rooms, things that we never thought we'd see in SMA. And this, I truly believe, it's the start of hopefully something bigger, meaning the next disease and the disease after that.
This amount of virus, sort of for a world's disease population, nobody knew how to make that much in a way that was compliant with the world's regulatory bodies. And you know, he led the cause to figure that out.
I think even when you look at the whole spectrum of how research and science gets funded, the National Institute of Health, the government fundings, the private foundations, these typically, they get you far down the runway, but they don't get you to some of the extremely expensive aspects of trying to run larger clinical trials. And that's really where we came up with a concept of taking this discovery and starting a new company. We at Avexis take our focus of why we show up every single day is for the patient. It's for the family who has just been given the diagnosis of spinal muscular atrophy. You know, a marching goal of ours is changing textbooks.
Every piece of data, every experiment we ran said that this was safe. And more importantly, it said it would work. And so at that point, you have a duty.
And we took a very different approach because we were looking at the finish line. And the finish line is getting this drug approved globally and treating every single SMA patient who can benefit from the drug and be treated safely. That is our end goal, and until we get there, we will not rest. We are working on trying to expand from spinal muscular atrophy to other rare, life-threatening neurological diseases, like Lou Gehrig's disease and also Rett syndrome.
All girls are different. A lot of them are higher functioning. Kelly's a little bit more on the severe side because she never did walk or talk.
It's an autistic-like spectrum disorder. Essentially, these girls are locked up. They can't communicate. They can't talk. Many of them can't walk. And we're extremely excited about at least our preclinical models. We have some of the longest living Rett syndrome mice than anyone else in the world right now.
It's hard. She's basically locked in a body that will not do anything for her. And so we have a lot of hope that hopefully AveXis is going to cure her. This is the first real hope we've ever had in years.
The news that these kinds of things can actually happen very, very soon, that's success. Progress in research is great, but success is actually things like this change for Kelly and girls that have Rett syndrome.
Upon approval, the first person that I would call is my wife to say we did it.
I think we're just gonna cry. It's his team and it's hundreds of people behind it, and it's years of just work. When the drug gets approved, protocols of newborn screening are going to be changed. Textbooks are going to be rewritten. Lives are going to be touched and changed.
To hear, "Mom, I love you," I mean, that would be the most miraculous thing ever, to hear her say, "Mom, I love you." She says it with her eyes all the time, but I would love to hear it with her voice.
My first project in science was gene therapy for spinal muscular atrophy. It's the only thing I've ever done. I've met lots of families, and I've sort of seen the journeys that they were forced onto. Young people. And they didn't ask for this. And that we can potentially stop it. You know, that more families won't have to go through this. It's amazing. So we need to go beyond this. We need to go faster. We need to go farther. You know, these are the sort of traits that he's continued to model and exemplify.
There's risk in anything. Doing nothing is the easiest. Doing nothing is the safest. So I'm proud of the boldness and the risk-taking, and I think that's how things change. Don't just do the simple experiment. Don't do the thing that seems always most obvious. Incremental science is important, but relish the potential to make a huge impact.